Good afternoon, and thank you so much for joining the Lee Kuan Yew School of Public Policy's Asia Thinkers series. The focus today will be on mental health, shaping community outreach and policy initiatives. I apologize for the slightly late start. I guess good things take a while to begin. And we have a great lineup of speakers today for you. Very power-packed, very experienced, and we'll love to have that important interaction with all of you. Before I introduce these three illustrious speakers, there will be, as mentioned, a very interactive activity in the form of poll questions. There'll be 2 poll questions. Please refer to the link on Facebook Live. The links will be shared for the poll questions. And of course, we'll love to hear your important questions and comments. Please type them in the comment box of Facebook Live as well. Now, the focus today, before I introduce the speakers, is on mental health. Mental health is an issue that is really important and close to our hearts. Some statistics that I'd like to share with you. An NUS study showed that 1 in 3 teenagers experience loneliness, depression, and anxiety. In one of my own studies, we have also found that if we look at a 40-year projection, social isolation among older adults in general will increase 4 times in the next 40 years. And also, when it comes to suicides in 2022, the suicide rates were the highest in 20 years in Singapore. Those are some of the dismal statistics that led us to why mental health is really important. Of course, when we talk about mental health, not everything is doom and gloom. We also want to balance up with the positive aspects of it, such as resilience, grit, and so on. So today we'll talk about some of these important issues. So without further ado, I'd like to quickly introduce you to our power panel today. We have Dr. Justin Lee, who is a senior research fellow at the Institute of Policy Studies. Love to welcome him, my colleague at the LKY School. Next, we have Ms. Anthea Ong, who is a mental health advocate, a social entrepreneur, and a former nominated member of parliament. I've known Anthea we were talking about probably over 10 years now. She has such a good heart and good mind for these important initiatives. So thank you so much, Anthea, for joining us. And we have Dr. Raina Tan, who is a visiting research fellow at the Saw Swee Hock School of Public Health and the lead at the SG Mental Health Initiative. So welcome, Justin, Anthea, and Raina. So let me quickly hand over to each of them to share more about themselves and their important work. We'll begin with Justin, we'll go to Anthea, and then Raina. Justin, please, over to you.
Thank you, Ruben. I'm the least illustrious of the speakers, plus I have no deep understanding of mental health issues. The reason why I'm here, I suppose, is because my work involves policy innovation. So I come from Policy Lab, and our job is to look for solutions that we haven't tried in Singapore, maybe look for partners or funding, and then try certain concepts, do light touch evaluations. And what I wanted to share in relation to this is a sense of how we think about the solutions. It's also interesting because how we think about the problem of mental health and how we think about the solutions involved in addressing the problem tells us a lot about the paradigm that we live in, and also alternative paradigms and alternative solutions that we don't see. So for example, if we think of the dominant paradigm of which we solve many social issues is service provision. And in fact, our non-profit sector, they are largely made up of social service providers. And in this paradigm, the idea is that you have to have evidence-based practice, you have to have increasingly professionally run services, and preferably roll out at scale. So if you are talking about mental health, then we're talking about not just medical interventions, but the talk therapies, the psychotherapies, and then all these para-professionals like the social workers and the counselors are all involved. But that's the service provision paradigm. And there are certain limits to the paradigm, it seems, because if you require a professional to deliver a paradigm, then now I'm saying that we don't have enough professionals to serve the population. There's only so much you can, and one school has one school counselor, not enough. If you're thinking within that paradigm, there are certain natural limits to it. The alternatives to thinking about how to solve issues, then there are at least 2 or 3 other alternatives. So one is the community development or mutual aid. So these are kind of adjacent things. where instead of thinking about what services we can provide, we are thinking about how can we build stronger communities, identify their natural assets, interests, and strengths, and how can communities come together to solve problems that they face together. Mutual aid is the same. There's no need for permission, professionals, or even philanthropy. There's a peer-to-peer relationship, and people can come together to try to address and meet one another's needs. So I give you an example. So we actually did this without permission, without professionals, and without philanthropy. I was thinking of doing community circles. And community circles, actually, if you look at the landscape of care, is absent in Singapore. So we have professional care. Of course, we have caregivers. And then there is befriending, which is the one person come to be your best friend and absorb all your sorrows and try to be all for you, and very burdensome. There's also peer support groups. So peer support groups are people who face similar experiences. They come and they commiserate their miseries and support one another. I'm oversimplifying it in a terrible way, but community circles is forming a group of, let's say, 5 to 7 volunteers to come and support one person. Quite different from the befriender model, right? So the 5 to 7, then they bring in different assets and strengths and interests. You don't have to feel like you're responsible for everything. So it's almost like it's a facilitated support, whereby the person with mental health is at the center of the support. And because you show up, and if you ask me whether I want to befriend a person or even a senior, right, I think I cannot. But if you ask me, can I show up 1 hour once a month over a year, then it feels okay. Plus, I get to know all these other interesting people, and what they share would also be kind of useful for me as learning and insights. So we did this. I thought that this would be interesting to pilot. So we actually did. There was a communitycircles.uk. We went to study them. I even budgeted for some funding in order to train and equip our local practitioners how to do community circles. And then when we actually looked deeper into their website, we realized there was a do-it-yourself manual. There was a modular videos to teach you how to do things. And we thought, wow, we can actually do this already. So this leads up to my last point, right? The third logic is then the commons, or contributing to the common good. We asked the ED of communitycircles.uk, why do you make everything so accessible? Because that's very different from the dominant paradigm. Dominant paradigm is there's a service, you want to license it, you want to protect your intellectual property. You don't make it freely accessible to anybody. People need to get permission from you or get trained by you to do this. And he says, yes, that's very true. Everybody tells me there's a really bad business model, but it's such a good social model, right? It's contributing to the common good, and anybody can take that and run community circles. And so that's kind of my brief kind of overview of what are the solutions that we're thinking of within the dominant paradigm, and what other solutions are beyond our usual imagination. And that's all from me.
Thank you so much, Justin. I think your sharing is really important. I learned quite a few things. I think not to focus on really provider-led solutions, but really community-led and individually empowered. I think that's really critical. And the other thing I learned from your important sharing is this idea of, framing is really important, right? Sometimes when we say these are befriending programs, it's almost making people feel as if they don't have a friend. So somebody needs to befriend me, right? So instead, we call it community circles. Everyone is on equal footing. We are supporting each other. So this framing, I realize, is so important. Now, I'm a data scientist by training. I do a lot of data science work around the region. And sometimes in some countries where we do programs and we call it data literacy programs, there's a lot of pushback. Because people think, data literacy program, are you saying that I'm illiterate when it comes to data? So, then we decided, okay, then maybe we shouldn't call it. We call it data innovation program, and everyone is happy. When it comes to framing also, I realized that I do a lot of research among the aging space, among older adults. And one of the key issues that we're working on is bone health. Now, bone health in Singapore is very medicalized. People automatically think of osteoporosis, and then they think, oh, that's not me, therefore I'm not going to do anything preventive about it. But in Australia, it's so interesting. They have refrained bone health away from it being so medicalized. In fact, the Osteoporosis Society of Australia recently renamed themselves as Healthy Bones Australia. So sometimes I think when we discuss health and mental health, we become just too medicalized, but maybe more about that later. Let me hand it over to Anthea for your comments and thoughts.
Thanks, Ruben. And thank you, Justin. That's such a great, stage setting and a great segue to what I think I'm just going to share. Like I said, very informally, I really want this to be more of a conversation, especially also with the audience out there on Facebook Live. Justin raised very many important points. And maybe for me, let me just try to get us to learn a bit of the history of mental health in Singapore, as Nick's stage setting. And so actually, Justin and Ruben both talked about how we move from a provider-led, or in our case, we talked about being more medicalized to a more community-led approach, right? Both in terms of shaping policies, but also in terms of finding solutions. And in fact, we have done that. So as a country, we have moved from, at least in terms of policy narrative, we have moved from a medicalized approach to a community-led approach. And that has been manifested at some level, and I'm going to caveat that, and I'll come down more into the details later. And in the form of a community mental health master plan that was first mooted, I think as far back as even 2012 or 2015, right? And it's actually gone through a couple of iterations. The challenge there has been, I think the framing that both Ruben and Justin have talked about. As much as we had that intention, both in policy as well as the, implementation approach, the actual actions on the ground, the concrete actions on the ground have not actually been congruent to the intention, right? Only in the last iteration did we start to see a big push. Even then, it's still coming from a very medical approach. So the first level of KPI, very Singaporean speak, but you'll all understand. The first level of KPI with this community mental health master plan was to make sure that we make the primary care providers, the general practitioners and public polyclinics, the first responders, right? So as much as we talked about it as community-led, it still goes back in terms of the solution as a medicalized provider-led approach. And I want to bring this up because of what the two gentlemen have shared, that to just see that actually that intention has been there, but maybe the challenge comes in the way we execute it, right? The policy intention was there to make it move towards community-led. The other clearly is the way we organize. Justin talked about the dominant paradigm. I would say the dominant narrative in terms of solutions for such challenges clearly comes from the government, the authorities. And up until today, Rainer will share more when he take you through the SG Mental Health Matters Policy Watch findings. But it's very clear that there is still a lot of load and burden on the Ministry of Health to take care of the mental health issue in Singapore, right? And if it is, then clearly it's still going to be coming from a very clinician-based or a very clinical pair of lens. So I just wanted, that was more a segue to get us to understand that intention is there, which is a great start. And so now we need to unpack why it has not happened, even though that intention and that narrative has already started. In terms of mental health, there are only two mental health legislations in Singapore, which is the Mental Health Care and Treatment Act, as well as the Mental Capacity Act. And since we started as a country, even before when we were a colony, we've not actually looked at more preventive, way of legislating mental health. And so I'm really heartened that increasingly from the World Health Organizations, but also from the community, we're starting to look into population mental health. In fact, we have a head of population mental health in IMH. We have Rainer here who can share a lot more. WHO also gets us to look into social determinants of mental health as an approach in terms of how we create the solutions that are needed to address a challenge as so complex as this. So having said all of that, we have a community mental health plan, very much focused still on getting the GPs on board, and of course, some of the social service agencies. So again, very provider-led. We still don't have a national mental health strategy at this point. And that was something I called for in my first budget speech. The government has promised that there will be a national mental health strategy. And I'm not saying that this is all coming from the government, but I think, even if we want to have mutual aid, mutual support, and we want to, have more of the community-led solutions, it's important that there is some framework that, all of these players and stakeholders are working within or with, right? And so that national mental health strategy is what I think we can expect soon, hopefully next budget, from the efforts of the Interagency Task Force for Mental Health. And 12 preliminary recommendations have been made. There was the first public consultation that was made on mental health policies, I think last year through to this year. And so those feedback are being worked on at the moment. So I think that would translate into what we will call the first national mental health strategy for Singapore. I think it's important to also say that as we talked about more the community-led perspective, what we saw from the task force is also how the task force was made up, right? And the community groups were not as well represented. They are there, some of them are there, but I don't think they are well represented. So I'm going to stop soon, but I want us to just, I want to just also mention, and Rena can share a bit more, that we need to also look at the intersectionality of mental health when we talked about community initiatives and how that can shape policy, narratives and actions. And that's really important in terms of looking at persons with disabilities, ex-offenders, LGBTQ, the comorbidities with the aging population, but also the racial minorities. You may not know this, but Indians form 20% of our population, but they form 20% of our total suicide numbers. For example, right? And men in Singapore are 2.5 times more likely to kill themselves by suicide compared to women, but 7 more men are likely to kill themselves by suicide than women. So I think those are some of the things I want to put out there for us to discuss. Last but not least, if I can, to also talk about the role of parliamentarians and MPs, and which is also why we felt that an initiative like SG Mental Health Matters is very important. To not only look into just what are the resources out there, but to be very focused on educating the public on mental health policies, and therefore the role of their elected representatives in bringing these issues into Parliament, that then creates a more robust discourse in creating the solutions that we need for this complex challenges. And I've gone through that as a personal experience, and I feel that's an important point to raise. I'll stop there so that we can go on to the discussion later.
Fantastic. Thank you so much, Anthea, for taking us through a tour de force of these different initiatives. Over to you, Reina.
Thanks so much, Ruben. And yeah, it's really tough act to follow, from everyone else. But I'll respond first. I read something today that I think resonates a lot, because just so happens that in the Lancet, which is, I guess, the top medical or health policy journal out there, there's an article today published called Transforming Mental Health Systems Globally, Principles and Policy Recommendations. And the first line of the summary says, there's a burgeoning mental health crisis that's emerging globally. And we argue that effectively responding to this crisis is actually impeded by the dominant framing of mental ill health through the prism of diagnostic categories, leading to an excessive reliance on interventions that are delivered by specialists, a scarcity of widespread promotive, preventive, and recovery-oriented strategies, and failure to leverage diverse resources within communities. That's exactly what was written in this paper that was published today. So it's very serendipitous, for I guess today's panel as well, right? Really sets the tone for that. And I think I guess I'll do a really quick introduction to myself and then go into what SG Mental Health Matters does. So I do research at the Social School of Public Health. Actually, I do research on like community engagement, and these are largely in the fields of stigmatized diseases such as like HIV, or stigmatized health issues like substance use. Because I think by circumstance, a lot of these communities rely on community support rather than like a top-down type of support to maintain their well-being, their mental health, and so on. So I think there's a lot to be discussed in that area. With SG Mental Health Matters, this is something that I guess started when Anthea was in Parliament as an NMP. And actually, I guess in all honesty, I wasn't there at that time. But from what I know, there was actually a public consultation that was done at the time. And I think with Anthea's a very innovative model of getting angels to help out with a lot of the Anthea's angels, rather parliament legislative angels, who are helping out with a lot of the speeches, a lot of the background research, and it was all voluntary. And I think even for all of us who are helping out with SG Mental Health Matters right now, it's an entirely voluntary endeavor. We are doing it because we feel a calling to at least try and I guess raise awareness and raise the profile of mental health. Because it matters to all of us. I think with SG Mental Health Matters, all of us have lived experiences of mental health challenges, or are caregivers of individuals with mental health issues or challenges. And I think that's where it's a starting point and sort of the common thing that binds us together. So I think with SG Mental Health Matters, we've done a couple of large, not large, but to us it seems very large because it's all like voluntary efforts, right? But in the last couple of years, from 2021, we did another public consultation in 2021. That was done in collaboration with this platform called OP. And that actually allowed us to field about like 20 poll questions. And we got some responses on what people were thinking around some of the mental health issues out there. And I mean, also as a researcher, there are some limitations in terms of like sampling and all that. But I think we've got a full report out there. You can read it. But one thing I would highlight is that this public consultation allowed us to see what are some of the issues people feel strongly about around mental health and well-being. And some of these things include suicide and self-harm, vulnerable communities. I think in 2021 it was still within like the COVID era, right? And I think vulnerable communities, including medical professionals at a point in time, migrant workers, low-income migrant workers especially, these were all things that were raised as a high consensus statements and issues in our public consultation. And this actually helped us inform a lot of the work that we were doing for Policy Watch. So SG Mental Health Matters Policy Watch is one way that we engage with a mental health policy. And what we do is actually on a monthly basis, based on the order papers and the parliamentary questions that are filed by parliamentarians, we go through them, we look for questions related to mental health. And along the way, we also learn a lot about what mental health really is. Because when we first started, we were literally looking for words like mental health, and like mental well-being. And after a while, we realized that we had discussions. So like person A felt that this was mental health related, even though those words weren't there. It was related to, for example, like special needs for children. So is this mental health related or not? And I think after that, we started to grow in our understanding that mental health is not like about literally looking for words that are specifically related to mental health or to diagnostic categories, but also looking at some of these intersectional issues that are related to mental health. Like social determinants that are related to mental health as well. And so with our 2022 SG Mental Health Matters Policy Watch report, we actually went through all the PQs again. Thanks to the Hansard and the search engine there, we were able to sort of look through all the different keywords that we had. And these keywords were around like direct references such as mental health, mental well-being, mental illness, and so on. But we also included keyword searches that involve the categories that were raised during our public consultation. And these included keywords around suicide, self-harm, different vulnerable groups like healthcare workers, doctors, nurses, LGBTQ plus individuals, low income, rental flat housing, mood disorders, a whole range of them. And so, with that, we actually found that about 10.8% of PQs raised in Parliament were related to mental health. So a total of 2,515 parliamentary questions were raised in Parliament in 2022, of which 271, which is 10.8%, were related to mental health. And I think mental health PQs peaked in October, which is also like World Mental Health Day. So I think that was something else that we found. But I think one thing that was really interesting is that most intersectional sort of mental health PQs were addressed to the Ministry of Health, about 41.5%. But actually, the remaining majority were not addressed to MOH. And why is this significant? I think it's significant because our interagency task force is currently sitting at MOH. And I think if we think about the intersectional nature of mental health, I guess as citizens and as individuals with lived experiences of mental health, is that in terms of like policy mechanism, does that empower MOH to also address some of the intersectional mental health issues that may be under the purview of other ministries? So I think that's something that we kind of raise as a question for discussion as part of our report, which we've launched and finally uploaded. We launched a couple of months back, but we finally uploaded it this month onto our website, sgmentalhealthmatters.com. And I also preface everything by saying that as a group of voluntary, individuals with lived experience, I think it's always different people pitching in at different points in time to really pull things together whenever everyone has bandwidth. But yeah, I'm going to leave it over here for now. And thanks so much for letting me share more about our initiatives.
Thank you so much, Reina. Thank you for sharing a lot of these important initiatives and how a team of volunteers have managed to achieve so much for this really important issue. Now, before I invite Justin, Anthea, and Reina just to comment, and reflect on what each of us have mentioned, just a friendly reminder to all of you attending the Facebook Live to take part in poll questions. I believe the link has been sent out on Facebook Live, so please take part in that. I'm personally very excited to look at the poll results. Justin, any reflections on what Anthea and Reina have shared?
My initial reflection was that Reina knows this because he studies the social determinants of mental health, right? But mental health often in the popular imagination sounds like an individual level problem. Some people have issues, your personal troubles, and others have not. But since you're in public health, you well know that it is a systemic structural issue, and perhaps we could also think about. I kind of quite like, perhaps we can ask parliamentary questions about mental health beyond MOH. We could ask MTI, EDB, because there's now this concept, possibly a psychologization of the economy, right? There's now this thing called the well-being economy, an economy that contributes to happiness, that contributes to a kind of regenerative nature and to human goals. Our current economy is about growth, right? And about serving shareholders largely. And if you think about that, growth is like a cancer. Growth on its own terms, it will soon exhaust our ability to thrive. But that paradigm is so hard to get out of. I think only in our current, the climate change has made some of these really unorthodox or so-called far out ideas, ecological economics, way more serious than just a few radical intellectuals talking about it. So I really like thinking about how we can talk about mental health in a systemic way, and starting with the economy, right? Our economy is not one that serves the community, and so maybe it is some people talk about AI in the same way, right? Some AIs have hallucinations. I think our economy doesn't have good mental health.
Justin, that's a great point. What you mentioned got me thinking about this idea of policy ownership, right? So yes, the policy owner is MOH, but mental health is it's such a complex issue that it almost needs a whole of government approach. We have done evaluations across different countries about responses to the COVID-19 pandemic, what worked, what didn't work. And I think one of the key success factors in Singapore was because COVID-19 was really faced through a sort of whole of government approach, right? Such as climate change and things like that. But somehow mental health is not quite there yet. So maybe taking a whole of government approach, then we can ask, right? Almost every agency and ministry to take a mental health consideration when it comes to the economy, to so many different issues. That could be something to think about. Anthea?
Thanks, Ruben. You just said a lot of what I wanted to say. And I also shared that in Parliament, I'm still with you. In fact, that was my entire budget speech in 2019 about how mental health really should be a whole of government, but also a national priority for us, because as Justin correctly pointed out, there is a negative, relationship between growth and well-being. And Justin, you're absolutely right. And that was also one of the things that we have been putting out from the community in the mental health sector, is that, no mental health challenge that an individual face is a personal failing, because there are all of these structural factors that are also at play that resulted in you going through that challenge. And I'm not saying we don't, claim responsibility for what we're going through, in terms of challenges. So I think that's an important point. To your point, Ruben, exactly why we cannot, number one, continue to keep mental health and policy ownership for mental health under MOH. And there were already signs of it being shared. And so a few years ago, a part of that was also parked with the Ministry of Social and Family Development, MSF. In fact, for a while, MSF was looking after sort of the general mental health challenges, but more, again, from the services providing lens, right, for people already with mental illnesses. And then MOH was looking more into the elderly, mental health challenge. What we think we have come through is we need now a permanent mental health office, right? If you think about the national priority of Singapore, and you just need to look at which are the offices under the Prime Minister's office. We know that the Smart Nation and Digital Government Office, SNDGO, right, that sits under the Prime Minister's office. And there has been somewhat of a model, operational model that has come about, right? There always will be a minister in charge. There will be a ministerial committee. In other words, the ministers who are relevant and who are affected and who can contribute to this issue or area sits on the committee for this office. And then recently, of course, we have the National Climate Change Secretariat, who also sits under the PMO, right? And so I think as Singaporeans and as a country, we need to ask, is mental well-being of our people not as important a national priority that warrants a permanent office under the Prime Minister's office as digitalization, as climate change? Right? And I think that is a very important question for us to think about. So we've been pushing for that. I pushed for that in 2019 in that speech. We pushed for that in the public consultation in 2021 called Are We Okay? We asked for it again in this latest report that Raina took us through. We asked for one of the parliamentarians to raise this in the COS this year as well, the Committee of Supply debates. The government has shared that they will consider a permanent mental health office. I'm just hoping that we're not going back to putting this permanent mental health office under MOH, because I think we really need the authority and the teeth for us to push some of these changes that we talked about. As what Justin said, education policies, education curriculum, right? Workplace policies, what we do in MTI and MCI, everything affects how we are, in terms of our well-being. Total defense, psychological resilience, psychological defense is also a key pillar. So yeah, I would say that we cannot put mental health any less a national priority than digitalization and climate change. I'll leave it at that. That's my contribution.
Thank you for making that really important point, Anthea. Reina?
No, I think I totally agree. I mean, that's something that I think it's also really unfair to MOH to really have them to respond to a lot of things that might not be under their own like jurisdiction or like policy purview. So I think definitely I think it will be very productive to address not just like specific issues, but if we think about social determinants of health, like in my own research or this very basic search, like I think we've not used the term or the phrase social determinants of health in our policy documents, at least until Healthier SG came about, or in the last couple of years. And I think this aversion to that might be changing. And I think with like a permanent, maybe like a mental health office within the PMO, we might be able to have the mechanism to actually get such data structures also set up across the different ministries. So that's something that I think would be very promising. It could help us then think about a national suicide prevention strategy, for example. It could then also help us structure a lot of different things that require coordination, not just in terms of data, but also in terms of like policy responses. So yeah, I think that's where I would respond for now.
Okay. Angie, I wonder whether you might be ready to show us the poll results before we open up to interact with the audience through a Q&A. Okay. Angie is saying she's getting so many responses, she don't have the results yet, right? So okay, I think that there are quite a few things. Justin, did you want to say something?
Yeah, I would like to circle back to the idea
Please.
of having some kind of national strategic plan for mental health. And it occurred to me that is the paradigm, actually. That's the dominant paradigm, right? So disability, there's an enabling master plan, and from cradle to grave, early intervention to education to employment to community inclusion, there are services in place or community resources put in. But it occurred to me that, if we use the different paradigm to look at it, do we really need? No, I think we do need a national strategy, but there's another model of social change. So, for example, in the space of climate change, there are many small groups trying to what they've been called local efforts to a local response to a global issue. Climate change is so big. What can a small group of people do? And so there are examples such as transition towns, whereby neighbors come together, talk about whether to install solar panels on their roofs or come together and cut down their energy usage or set up community gardens. And so all these small groups you would think are irrelevant, won't make a difference. But actually, the local efforts, the way they make a difference is to proliferate, connect up, and inspire one another. So as more groups find out about transition towns, others set up transition towns in their locality, and they borrow ideas, they mix and match, and they try different things. And there doesn't need to be a kind of overall coordination, because it's more like a social movement where you proliferate and you inspire and you connect, and then it adds up that way. So it's kind of like a movement rather than a plan. And so that was interesting to me to consider as an alternative or parallel approach towards addressing some of these issues.
Can I respond to that, Ruben, to what Justin just
Of course, please.
raised? It's a really important point. In fact, I was going to jump in to also say that as much we talk about the National Mental Health Office and policies, we must not forget that there is the citizens' agency in change making, right? That we need to talk about. And I'm glad, Justin, that you raised a parallel with the local response to a global issue. It's very similar in the mental health space, except the mental health space is the added challenge of stigma, right, and discrimination that climate change does not have. In fact, a little bit of a personal share here. When I was first invited to be an NMP, I said no in 2011. I finally said yes in 2018 because the work that I was doing on the ground, as what Justin was talking about, right, setting up Hashiba and the different projects and trying to plug the different gaps. I hit a wall. I hit wall after wall, which were in more structural issues, right? Which we know that the two need to work together. I'm not saying that one is more important than the other, but when I hit many walls, whether it's in terms of affordability and accessibility in mental health care, because MediSave and MediShield did not provide for as much for mental health treatment as physical health treatment, right? And that just entrenched further the stigma, right? And so that's just an example. But I'm totally with you, Justin. I feel that this is why the likes of SG Mental Health matters. To your point, when you mentioned community circles, Resilience Collective is actually one such effort, right, where they actually support, these are for young people, they support a young person with a community, right, around them. And this is a person who needs the support in terms of his or her mental health challenge, but it comes in. So there are for sure 1,000 flowers blooming and blossoming on the ground. But I think there is also a need for us to make sure we don't continue to, as an official narrative and policy narrative, continue to have actions that come through policies that seem to keep perpetuating the provider-led approach, or more downstream approach instead of more upstream. And just one last note, Healthier SG has not brought in mental health yet, right? Healthier SG is supposed to go through the entire continuum of health, and mental health is not included in that. So again, there is a tendency that, the official narrative is still very much downstream, which has a lot of stigma attached to it, right? Because you already are ill, you already need help. But I think it's so important that we also have a narrative that supports community responses and initiatives to also go upstream to be more preventive.
Raina, any thoughts before we go on to questions that we are getting, quite a few of them?
Yeah, no, I think I want to maybe focus on sort of like community-led or community-driven kind of like initiatives. I think just thinking about Healthier SG also, it's kind of shifting it's shifting things more downstream. I guess in terms of like, okay, but we're still relying on specialists, to do a big bulk of the work. Like I guess the pivot is still at the specialists, the gatekeeping in that sense. Whereas like I've seen some models, at least in maybe my work around like say like sexual health and all that, like in HIV, in like Thailand, they have this thing called key population-led services where, like basically communities are certified by the Ministry of Health to, do HIV testing, to do counseling, and actually what happens is there is you turn the power dynamic around, right? Because then the doctor becomes just a prescriber, because you consolidate all the information that you need. As someone who has the same lived experience as someone else, arguably you might be more aware and more attuned to what the issues are. Of course, based on a particular knowledge structure or particular training program, that you might have gone through as part of being a lay provider. And through this whole model, you actually just rely on the who used to be the gatekeeper now becomes sort of like the one providing a service in that whole system. So I almost feel like that's something we could also I guess think about, and I mean in terms of like the drug use and addiction space, which so I'm currently one of the directors for the Greenhouse Community Services Limited. So it's actually a substance use recovery center here in Singapore, and a lot of the programs are actually community run. And I think like Justin, you mentioned like community circles. A lot of the support groups that are run for addiction are very much like that. Like the 12-step groups. These are all community run. But I think what makes them work is that they have a very strong structure that is run by a community that picks it up. So anyone can start like a 12-step group anywhere, but you have to follow the traditions of a 12-step group to call yourself a 12-step group, because these are some of the things that people along the way have learned that makes the group safe. So I think I like the idea of community-led kind of like services, and also especially in the space of mental health. But it seems to me also that there needs to be some form of like initial training, or initial kind of like integration into a particular structure or traditions or a particular model that helps to make it work as well. Because if we just throw the problem downstream, without any support, I think that's also not allowing communities to thrive. So I think that there probably is some resource management around this issue too.
Okay, thank you so much, Rina. Before we go on to the poll results, I would like to take one round of audience questions. And we just received 3 questions among others that are really interesting because it gets to the different levels of the system that we are talking about, both at the strategic level, implementation level, and individual level. So at the strategic level, we have a question, I believe it's from Professor Phua Kai Hong. He wanted to hone in on this whole of government approach. His question is quite lengthy, but I'll just hone in on the last part. How do you resolve this complex whole of government approach regarding responsibilities and funding, such as the defined office, I think, NTA you're talking about, okay? So that's his question. We have another important question on the implementation by Rain Lee, who has asked, what are some of the ways to enhance the integration of mental health into primary healthcare? Okay, so that's the other question. And we have a question by Amanda Lee, who has asked, what are some effective ways of improving mental health literacy in Singapore? Please feel free to take any or all of the questions. Maybe we begin with Anthea, and then Reina and Justin, if you want to chime in later. Anthea, go ahead.
Thanks, Ruben. Yeah, I think that's a really important question to ask. How do we resolve this complex whole of government approach in terms of responsibilities and funding? When we talked about the National Mental Health Office, I am not going to be here pretending I know at all, but I think some of the questions that we could ask would be, how has the whole effort, which is also really complex, in trying to bring the entire government together for digitalization. And that's obviously an ongoing process. What have we learned from that, right? Within the government in terms of the way we've organized ourselves. And you can see the iteration and the learnings from the way the SNDGO was set up, and then sort of, how that's been adapted or has evolved. And then how then when the National Climate Change Secretariat was formed and established, how that, took a lot of inspiration from SNDGO. And of course, based on the context of the issue, because the issue is relatively different, how we then also change the structure of it, right? There's no real, I think it's a living answer. It's a learning journey. For the government, but also for the whole of society, right? Because these complex challenges that we are facing, whether it's digitalization, whether it's climate crisis, whether it's mental health, no one is smarter than all of us, which is, I think, why we're having this conversation, right? It's not just having a national plan and everything will be done. It's not having everything on the government and then it will all be solved. It's also not all on the community, because there's a need for funding and support and some of these policies to enable more community responses that will be effective. So, in short, I think draw inspiration from where we have already come from, learn from, how we have, as a nation, as a government, try to solve some of these complex challenges in a whole of government approach. Even aging, just to also chime, because I was actually involved with it when I was president of WINGS, we actually had a aging planning office. As much as it was sitting under Ministry of Health, it was actually an inter-ministerial committee that was also formed to guide and lead that aging planning office. And that means that it also goes into things like, how do you create silver zones in estates like mine in Marine Parade, where there is a higher proportion of elderly and seniors, so it goes to that level, right? But because you have this, this coordinated office with a committee that is made up of the different ministers that can then drive some of these changes, and be given dedicated funding, so that not everyone who's involved in this is just looking at their own ministries, KPIs and funding, but there's a horizontal level of, outcomes and funding that are being organized around it. That's a long way to share that, but that's my take.
If I can add, I think what's interesting is New Zealand had a well-being budget. So, if government do things, you can always point to the money earmarked for certain purposes, or you can allow different people to make decisions about how to use the money. For example, you can have participatory budgeting thematically for mental health issues, and that changes the kind of solutions that professional-led service, what professionals might think is the solution. But but you could also, based on the same principle of who gets to make decisions, if it's really hard at the system-wide level to have this overarching plan to know exactly what to do, then one of the ways is to divest their decisions to the people who are affected by that, as much as possible, keep decisions local. So there are approaches, there are place-based approaches to dealing with all sorts of things like poverty, healthcare, and you could then try to give the people affected more decisions. One of the things I'm particularly interested in is giving the clients who have, let's say, mental health issues, right? Paying them for success. There's a lot of talk about, let's say, social impact bonds, right? Which is actually paying the service provider for success. Actually, you could pay the clients for success in the sense that, if you achieve this or this or this milestone, and people with these issues, like Ante was saying, that there's a lot of comorbidities, many of them are low income, and, they actually appreciate the money. Wouldn't you rather give them the money than give it to a counselor or social worker who will take your money to give them a service that they may or may not want? But I recognize that journey is quite hard. Somebody in recovery, it would be hard to achieve certain outcomes that even they desire. So then, to support that journey, pay the client for success, conditional cash transfers, but perhaps give them a personal budget or like a service expenditure budget. Right now, our service providers, they get money from government or philanthropy, and then they become the be-all and end-all for each client, right? I will give you counseling, I will troubleshoot for you, I will find you a job, find you a home to stay in. But you can't be everything for a client. Social interventions are pretty context dependent. Whether whether a therapist works out for you or not, it depends. It not works out for some, not for others. Mentoring works for some, not for others. So the idea is, if clients can choose from a menu of services, maybe they want to use a cheaper counseling service from a social service provider, or they want a more expensive psychologist from the market. They choose based on a personal budget. And it would be really interesting from a research point of view, right? What services would clients actually want to use if they had the choice? What types of services and which service providers would they use to support them in this journey? So that's something that I really want to try out in a way.
Please do, Justin. and I'll be happy to talk to you about this offline, because we do have actually an existing challenge of people with mental health conditions having a really high unemployment rate, right? So income, and that, as you can imagine, adds on to, the challenges, the emotional challenges they are already facing. When you actually don't have a job, or you can't actually meaningfully find, employment. So I think if we have a project like this, it might then help us to see whether that's a baseline, right? Because we're trying to really get this group out of unemployment and as an employer who also hires people with mental health conditions, there are different challenges. And very often, if they don't have enough of an income, they cannot access a lot of these services that would actually make them better and therefore help them, do better at workplace. So yeah, no, I would definitely love to discuss this further with you. I think it's a very interesting idea. Although there's a part of me that says, oh, do we always have to use money? But I think in this case, it's actually, this could be an interesting pilot to try out. Yeah.
Yeah, I was gonna also say that as you were speaking, I was thinking to myself, oh, I need to email you separately to talk about this. So I think we can start the conversation separately. But I think one thing that I'll just address around like integration of mental health into primary healthcare, I think is actually thinking about even just beyond primary healthcare, like in terms of the health system, because like in terms of principles to address mental health, one of them, let's say if we're thinking about social environments, that might exacerbate mental health conditions, or the progression of mental health issues, that is actually out of the healthcare system, and it's more like family environments, school environments, so like how I don't have a concrete answer as to the complex interventions that we need, or the system level interventions that we need right now. But I do know that that has to be addressed outside of healthcare systems. I think beyond that also, if we were to, let's say, rely on non-categorical diagnoses, as a way of addressing mental health, I think they call it like a staging model of a mental illness. Like there are different stages, and how it progresses. Some people have relapse, have like different stages that they encounter, but then oftentimes if you rely on the medicalized system, then it like if you haven't reached a certain stage, then you are not, I wouldn't say you're not welcome, but we wouldn't you're not ready to get treated, but there's so much that can be done prior to that within communities too. And like if you wanted to empower more like diverse kinds of providers out there, including community care, or other folks outside of the medical system, I think integration then looks like how do schools, how do families even, how do these structures and systems play a part in improving mental health care. And I think that's sort of what I'm thinking of based on that very I think very important question.
Okay, thank you so much, Raina, Anthea, and Justin. Anthea, did you want to respond?
Yeah, because there's another question that you were sharing that was asked by Amanda. And I thought that's important for us to also discuss as well. What are some effective ways of improving mental health literacy in Singapore? Amanda may not have heard what you said, Ruben, at the very beginning, when you said maybe framing the word literate or not literate is an important start as well. But anyway, I think it's a great question, Amanda. I think what we have typically been looking at mental health is it's very binary, right? We think that mental health is the absence of mental disorders, and actually, this model, Corey Key's model, has been cited, which is calling it the mental health continuum, right? So simply, you can look at just there is the illness spectrum. There's also the health and well-being spectrum, right? So you can be flourishing even with a clinically diagnosed mental health condition. You can also be languishing without actually a clinical mental health condition, right? And so this is a very simple way of changing and normalizing perhaps the conversation about mental health. Not so much about whether we are more literate or less literate, to Ruben's initial introduction of himself as a data scientist. But I think it's actually more about how much do we realize that, mental health is a human condition, right? We will always be on some continuum where, because of circumstances of life, we will go into a more challenging state of mental health. But that doesn't always mean that we are mentally ill. And so that conversation, I think, needs to happen. Yeah, I mean, the authorities, the government is trying to do some of this through Beyond the Label campaign. HPB has the It's Okay to Reach Out campaign. But I think amongst us on the ground, we need to be also having these conversations that are coming from a place of empathy, of curiosity, and of love, of creating safe spaces for these conversations to be had. Because the more we don't have this, the more misconceptions, the more stigma and taboo this topic becomes. But I would also say, Amanda, that we should start as young as possible. So mental health education now is going to be compulsory from this year onwards in all schools. So hopefully that's a start. But it's never going to be the be all and end all. I think the community, we the people have to want to learn more and hold space for more of these conversations to happen.
Thank you so much, Anthea. I think just to reply, also just to respond to Amanda's important question about mental health literacy. So years ago, we did some interviews with young people who attempted suicide. So they were in great distress. So when we asked them, why don't you seek help? The reason was very common among the people we interviewed, and it was very chilling. And the reason for that, why they don't seek help, is because they don't want to worry others. I don't want to reach out to my parents. I don't want to reach out to my friends, my teachers, or whoever, because I just don't want to worry them or burden them with my problems, right? Then the other spectrum, when it comes to age, when I talk to older adults who have been given a cancer diagnosis or some sort of life-threatening condition, and sometimes they don't want to tell others, right? They don't want to seek help. They don't want to open up. And the reason for that is that same chilling reason of not wanting to worry others. So we are trying to understand this interesting phenomenon that we have seen on two parts of the age spectrum, young people and older adults. So we're calling this the FOWO phenomenon, or the fear of worrying others, right? FOWO. What we're trying to do now is really to try to understand what this thing is all about. Because when I talk to people with same issues in the US or in the UK, elsewhere, it's not quite like this. I mean, the thinking about why they don't want to seek help is very different, right? So there seems to be this predominant fear of worrying others. So what we're trying to do in the research team now is to see whether we can create a four-wall scale. I mean, it's not formal, it's four-wall scale, to understand what aspects of it prevent us from wanting to seek help. But why is it that we not want to worry others? Because unless we measure it, we don't know how to decrease it, for example, or get a handle of it. The other thing, I think, when it comes to mental health literacy, that's sort of one of the impediments. The other thing about mental health literacy also is, most of the time when we talk about mental health, there's an ongoing research that that my team is doing on looking at media conversations about mental health in the last 10 years across 20 countries, of which Singapore is one of them. So we find that actually when we talk about mental health, there's actually 6 times more conversations when it comes to mental illness than mental well-being. So all these media narratives about mental health is largely negative, and it's always about illness. But we forget that actually mental health, there's a positive spectrum of it, as Anthea mentioned, which is resilience. So increasing resilience is extremely important. But resilience studies have been done, in a lot of different countries. And as what Justin mentioned, localizing it is really important. So when we found that there are actually 5 resilience indicators or strategies in the US, we found that actually 3 of them are relevant here. And one of them is thinking positively, positive thinking. The other one is tenacity. And third is help seeking, right? So I think it's important to localize the studies and also focus on the positive spectrum of mental health rather than always thinking it's just about what I cannot do. Then I wanted to pick up Raina's important point about, sometimes we are very binary or very categorical when it comes to mental health, right? You need to meet that threshold. I think that's the fundamental misconception of how we categorize risk. Most of the time, we look at risk in a very binary manner. Are you at risk or not, right? So we give a lot of resources to people who are at risk. But if you think about it, today, I'm fine. I'm low risk, right? So I'm not given any resources. I'm not on any programs. Tonight, my parents lose their job. Tomorrow, I'm straight away from low risk to at risk without any resources to manage it. The sort of predicament I'm in, right? So I'm thinking, and Thea, what you say is absolutely right. I think we need to think of risk as a continuum. Yes, we want to devote resources to people at risk, but we also want to distribute resources to people across the continuum, so that when things happen just overnight, when I'm tossed into a high-risk situation tomorrow, I will have resources to manage it. It's also interesting, Anthea, that you mentioned about SNDGO. So back when I was in service, I was in a smaller team, the precursor of SNDGO, SNPO, Smart Nation Program Office. There were just only 14 of us. I was the only one from the private sector at the time. The rest of my, really amazing colleagues were from other parts of government. And it was really interesting. I haven't really thought about it, thinking about how we can build this whole mental health office to parallel some of the learnings from how we look at digitization, looking at the different policy-making arms across different ministries, bring them out and put into SNDGO. That could be indeed a worthy lesson to consider. With regard to the funding, I'm actually thinking about how we fund our Skills Future project, right? This Skills Future program. And one of the ways that we are funding our Skills Future initiative is through corporate taxes. So every year, if you're a company, you pay corporate taxes. Part of these corporate taxes goes to skills development. Maybe, just maybe, a part of that corporate tax could also go to mental well-being development. Okay, just some thoughts to swirl around. Maybe let's quickly go to NG, if you can share with us the poll results. Then after that, maybe we can have a chat about the poll results and also go to the important questions. So let's look at, what do you think is the most important priority in shaping mental health community outreach and policy initiatives in Singapore? The answer that got the most votes was improving public health education around mental health issues and promoting greater well-being of mental health issues and challenges at the population level, followed by empowering communities of care by providing grassroots and civil society organizations. And third, enhancing the integration of mental health in preventive health activities, for example, putting them as part of Healthy SG, and finally, ensuring stronger networks and ties between government and civil society organizations. Any thoughts from any of you before we move on, I guess, to the second poll question?
I'll chime in first. I'm chuckling a little bit that the one with the least votes is ensuring strong networks and ties between government and civil society organizations. And I think the rest sort of was what I expected, but I thought this would come higher than being the least voted, especially when mental health is such both a personal and structural and systemic issue that you really can't not have this partnership between government and civil society organizations in order to create this clear pathways to turn citizen voices into concrete actions, right? Yeah. So, but I think generally, I feel that it's very heartening to see the results, and I hope this also demonstrates or reflects where we all are in terms of how important this topic is for all of us here in the Facebook Live chat. Yeah.
Yeah, I can go next. Anthea, I saw you chuckling. That's why I was waiting for you to go first. It looked like you had something to respond. I think for me, I was slightly surprised that the first one got the most votes. Like to improve public education around mental well-being and awareness. But I think just thinking through it, I guess that makes the most sense. I think we haven't had this conversation very much, I guess, in Singapore. And like there's so much nuance, even just based on the conversations that we're having today around not treating it as a binary, thinking about it as a risk continuum. These are such important conversations to have in our communities of people with lived experiences as well. So I think definitely I do agree. And I also want to point out that even for the other stuff, I don't know too much about Healthy SG, but knowing that it doesn't really systemically include mental health yet, I think that's probably something that should be worked on. I know like Health Promotion Board, Ministry of Health Transformation Office, they have like grants, where it's like our Healthy Community Fund or Healthy Singapore Fund, I think like $20,000 where you can apply as a non-profit organization. to build communities of health, which includes one of the things also includes mental health. So, every quarter, I think they open it for funding. So if you are part of like a small organization, or I think individuals can apply as well, you can actually like apply for that funding up to like 20K. So I think those are some initiatives that I can think of that I guess, reflect some of these initiatives that are ongoing too.
Okay, Angie, shall we look at the second poll question? Okay, the second poll question is, what do you think needs to be a policy priority to improve the mental health of our nation right now? So we have two answers neck to neck. As first, one of them is improving our response to mental health and well-being beyond the healthcare system and ensuring a whole of government priority, and understanding how the conditions in which we are born, grow, work, live, and age, and how wider forces and systems that shape our daily life impact our experiences of mental health and well-being. Well, these answers are really quite complex. Okay, and then healthcare infrastructure, okay, that's another one, followed by improving the knowledge and literacy, understanding the mental health in our population. And last is having more data and research on how widespread mental health issues and challenges are. Any responses? Any thoughts?
I must apologize because I'm the one who also helped to suggest some of these responses. But I think one thing that I also reflect, well, if this came before, if people were answering these polls before what we spoke about, then it might look different, but like right now what I'm seeing, the two most important ones are social determinants and whole of government response, which to me is very heartening because perhaps what we've talked about today have helped also, have resonated with members of the audience, around how important a whole of government response and social determinants are. So I guess that's my response for now.
Justin and Thea, any thoughts?
I just have one quick one, which is that just looking at the responses, I think this is already a part of mental health literacy that we are helping to improve, right? And I think this sort of sessions and this kind of sort of conversations really contribute to this mental health literacy that we're talking about. But I think by and large, as what Raina said, it could be influenced by our conversation that we see the last two options, being the most voted. But I think I want to also add that it also comes from personal experiences, right? I would say that today in Singapore, it's almost impossible for you, even if you've not gone through mental health challenges yourself, which is, well done. You would know of a loved one or a friend who have gone through it, right? And so the two options really speaks to you at a very personal level. That it's just all around. It's almost, omnipresent, and the need for a sort of a more systemic, approach to how we address this. It's really important. So I'm really happy to see this. The other one I was chuckling. This one I'm very happy to see the responses.
Okay, so those are two of the poll questions. I'm going back to quite a few of the questions that are coming in. I'll just read out some of them. From Anisha, there is a question about whether there's a need for a body that monitors ethics in the mental health space. And I think this is also tied to Kai Hong's question, which is what is the criteria, what are the professional standards to be set, right? If there's a government agency that's going to ensure accountability of outcome measures, what are some of these professional standards? Yeah, would any of you like to maybe share your thoughts on that?
I can go real quick first. I saw the question and I really love thinking about it because I personally have been helping to facilitate or run support groups more on maybe let's say in substance use related spaces. I've also been part of ethics committees, as my job in research. And the way that we view ethics and ethical dilemmas are so different within the community and as part of an institution. And sometimes it also gets conflated with ideas of like protecting an institution from some kind of risk as well. So I think it's important to have uh, some form of like governing uh, approach or body. Like I think in like the support group spaces and community-led spaces, we're often guided by principles that we have agreed on as a community. Where it's like a certain ground rules, certain safe spaces. And I think ethical dilemmas do come up in service provision in the community as well. And I think with these, they tend to be resolved by our organization, our board of directors, these are brought up. So I do think that, even for community-led or community-driven kind of initiatives, it is important to have some form of a accountability kind of mechanism. But these, I think, have to be set by the communities themselves. These are not something that, there's a blanket like ethical, like a body that does these things. And I think that helps, especially when a lot of the issues that are raised are so specific to your communities that you are empowering. And I think so I think that's the main thing that I wanted to point out based on my experience.
I can add on to outcomes in the sense that that's the question that usually comes up, right? How do you evaluate impact, measure outcomes? And typically, I feel that we skip over one important step. The important step is, figuring out what should count as success, which is, sometimes the evaluators call this values inquiry. And I'm reminded of how when I did a project on people with disabilities and their employment prospects, all these job placement and job coaching services were evaluated on two criteria: the funders and the government's criteria, which is how did you get placed in a job, did you keep your job for at least 6 months, and how much were you paid. But those, even though they were very meaningful outcome measures, they were simply a small subset of a wider universe of things you could potentially measure. And when you talk to people with disabilities, they say that other things matter, right? Did the job coach explain to me, did I have knowledge of what having this job means for right now? Were there accommodations made? What's the implications for my future career path? Did you give me choice and autonomy? Did you just forward me to take this job interview because I have an engineering certificate, but you didn't ask me whether I was interested in any other job? So there was choice, autonomy, respect, all sorts of other values that came up. But the only things that were measured were effectiveness and efficiency criteria. And so that's often missing. And also, it feels to me that, having worked with a lot of funders and social service agencies now, that it almost feels like evaluation is their go-to tool in order to figure out what to do next. Maybe a solution or a service is you're not quite sure about it, so you just pay a lot of good money for evaluation and then see where it goes. And I'm reminded of this beautiful quote by this Chinese author, and he says that, Lao She, he says that no matter how much criticism, which is evaluation, will not turn a block of marble into an exquisite sculpture. And that's the logic of evaluation. Right? Logic of evaluation tells you, did it work? It didn't work. Why not? That's critique, right? That's evaluation. But what to do with it is a different logic. The logic of design and development is an entirely different. So I sometimes feel we put a lot of our eggs into the evaluation basket and less on the research, design, and development basket.
Okay, thank you so much, Justin, Anthea, and Rainer, for sharing your thoughts. We're just going to take two more questions because time is running out. I guess time flies when we're having fun. So just two more questions here before we wrap up. The first is by Arun Mohan, and question is really around what are your thoughts on the disparate suicide rates in Singapore, especially when looking at demographic variables such as ethnicity? There also appears to be very little data to investigate what's going on. So that's one question by Arun. The other question, important one, is by Mei Chang. She has wrote quite a long, background to her important thoughts. But I think it really distills down into what can the education system do to shape such a mindset that creates a positive attitude, a sense of belonging to community. What are your thoughts?
I'll just jump in here. Hi, Arun. So Arun reached out to me on LinkedIn because of his, this question that he's actually raised here for us to discuss, which I'm really happy that you did that, Arun. So I mentioned that briefly earlier, the intersectionality, and you're absolutely right. I think this is also one area that Raina and I talked a lot about at SG Mental Health Matters, and what more we need to do to uncover more of this intersectionality, but also what's not even talked about at all, like the racial, the racial aspect of suicidality. And actually, Arun, until you actually came forward to share with me, I did not know that this disparity exists. And so I think that means that, there's just so much more that we need to unpack. We are actually in the midst, a few of us are in the midst of forming a working group to look into developing a white paper that hopefully forms the blueprint for a national suicide prevention strategy. I have to say that I was personally a bit disappointed that the Interagency Task Force for Mental Health did not include suicide prevention as part of their agenda, or at least it's a key agenda. So we're going to come together. Again, this is a community response to Justin's point. And we're hoping that, therefore, in this more dedicated working group, the work that we're going to put in, the effort that we're going to put in, is going to drill down deeper into the intersectionality within the suicide prevention strategies that we need to come up with.
Yeah, I'll quickly add also, Anthea and I wrote like a commentary a while back, and actually for IPS Commons, right, about, and the title was, minority health isn't a minority issue, but an issue of public health equity. I think, if we think of it through like a social determinants of health lens, and, like race and ethnicity definitely is a social determinant of health, what about ethnicity or race that, places that causes such disparity? Sometimes it's like there are socioeconomic factors, there's stigma, there's discrimination, some of these things need to be further, studied, like measured. And, I think even just based on the lived experiences of people, and, just talking to people about their experiences as, like, say, ethnic minorities or racial minorities, you can kind of tell, why, some of these disparities are taking place, right? And I think, it comes back to one of the principles of like mental health policy, right, which is centering people with lived experiences. I think that's why, it's important that we kind of like, I guess, review how we, who we center and how we do that in terms of mental health in Singapore.
Justin, go ahead.
I mean, it occurred to me that everyone always tries to get the educational system to get the kids early, then they'll grow up well, they'll be well, and then all our systemic problems will be solved. And I think that's probably not going to happen. In a sense, even if we had a nice kind of ways in which to engage the kids to learn this or that, it feels that it should be a kind of an all at once, if not nothing at all approach if you want to solve this systemically, right? So minor tweaks here and there. I'm reminded, even if all our schools were good schools, the school is still a sorting system, because what's the meaning of all schools are good schools if not all jobs are good jobs? And our economy, this kind of growth mindset, which squeezes people. Let's say you have a social worker. A social worker is using an individual level tool to solve a deeply structural problem. Then they get burnout. Then what do you do with the burnout? You have burnout workshops and training courses to help social workers cope with it, but the system is the issue, right? So you keep doing all these kind of band-aids and minor tweaks and here and there is not going to work out. And so I would say, there are alternative ways of thinking what a school is. There are alternative ways to think what our economy should be. There are alternatives to debt-based money. Everything could be done together. I'm reminded of, I went on a study trip to Scotland, and I think in Singapore, at least, our third sector, or the community sector, is considered to be a kind of impoverished and subsidiary sector. The real powers are state, and markets, right? Big organizations and corporations changing things. And community is often just, give them some money, they do some philanthropy, maybe you do bingo and karaoke with the seniors, and that's the community stuff. But actually, overseas, community life is a site of serious economic activity. Kai Hong was asking about how do you fund all this community stuff, all this fun, uninteresting stuff. Actually, community-led enterprises such as community development trusts and worker-owned cooperatives can be very serious ways of using an enterprise to meet community needs instead of the other way around. And so I think that's at least my pathy thoughts. The community is not a subsidiary and should be, we should focus on the values and what the purpose and meaning of life is, and then to safeguard that against sometimes the unintentional co-optation into this kind of administrative or market logic that actually takes away from what you're trying to achieve.
So really go down to the fundamentals and think of really alternative paths. I think that's a good way to think about it. Andy, I just wanted to pick up on yours and Raina's point around intersectionality. This intersectionality, it's really real. So there's an ongoing study that we are doing across over 100 countries, looking at how people face multiple discrimination, gender discrimination, ethnic discrimination, and age discrimination, right? So sometimes it's not just, we tend to look at them alone. But if we look at them together, we realize that there are actually people who are discriminated based on their gender, ethnicity, and age. And age, I mean, in terms of ageism is a very weird thing. It's bias against people because of their age. It's almost like discriminating your future self. So it's all this ageism stuff. It's really serious. And when we look at intersectionality, I think we look at the people who have fallen through the cracks and who really need the help. Right, so I think it's important to look at some of this work. I think before we end, I just want maybe each of us to maybe share sort of a takeaway. What's a takeaway that you would like our audience to have as we conclude this session? Maybe let's begin with Anthea, and then Raina, and then Justin, and then we'll wrap up this important session. Anthea.
Thanks, Ruben. And well, before I start with mine, thank you for moderating this, and thank you to LKY SVP for having us. I think I just want to share with all of you who are listening in that a mental health challenge is not a personal failing, right? And I hope that from this discussion today, you understand that if you are still, fighting every day to be well, to, get out of the house, I just want you to know that you're doing a really great job, because there's so many systemic issues and structural challenges that we talked about today, to let you know that it is not just on you to get well, right? There's so much we need to do as a society, as a government, to support our overall well-being as a nation. And I would also add to Justin's earlier point, we have to put the well-being of our citizens at the core of what we are as a country. I mean, as a key objective of our growth. It can't just be growth for growth's sake, but that the outcome must truly be the well-being of our citizens. So that would be what I want to leave you with.
Thank you, Anthea. And thank you so much, Ruben, for moderating. It's been a real pleasure being on this panel, and to the Kuan School of Public Policy and everyone who made this happen. One thing that so when I was doing my bachelor's, I thought I was going to be a psychologist, but I ended up becoming a sociologist instead, because at that time I was going through some I guess some mental health challenges during that time. And one thing about the sociological imagination, has always been about being able to make the connection between personal challenges and larger social issues. And I think with our discussion today, it really highlights how like a lot of things that we maybe experience on an individual level, public policy issues, or things that are larger, where larger social forces are at play. And I think that helped me find some relief as well, in terms of my own personal struggles. And I think that's something that I hope we can work on together collectively, I guess in Singapore.
I suppose to add on to the sociological imagination is that it's also useful to always question and be critical of our taken for granted assumptions. For example, I've been thinking about resilience, right? Resilience is a concept we kind of throw around as a good thing, especially for mental health, right? But is there a dark side to resilience? And I'm reminded, I feel kind of resilient, but in the sense that I'm kind of like a cockroach, right? I might thrive in a toxic environment, and because of my own behavior, I actually contribute to the toxic environment. I'm reminded of leaders who, they complain about how this new generation is strawberry. They don't want to take jobs overseas anymore. And for you to get ahead, and create that culture, you are contributing to the toxic environment, but you're quite resilient. So when is there a dark side to all these things? So that's kind of to be critical of all these things we take for granted. That's all I have. Thanks, Ruben, for facilitating.
Yeah, thank you. So I think my parting shot here really it's the main message I have for all of you out there is really it's really okay not to be okay. There's no shame. You just seek help and reach out, because there's sometimes we are down, but it's okay. Just reach out and seek help, okay, and pay it forward. I think that's a really important message. And while this may be the end of this session, but this is the start of a very important conversation. So you have met great resource people today, Justin, Anthea, and Rainer. Don't hesitate to reach out, contribute to the important work that you're doing. And most importantly, thank you so much for sharing your insights and time on this particular panel. Really appreciate it. I just also want to mention by name the team behind this whole Asia Thinker series, making this happen. Angie and the team from Entrium Media, my colleague Sherman, Lip, Andrea, Michelle, Megan, and Jamie. Thank you so much. I don't want to stand in your way of a Friday evening dinner with your family and friends. So it leaves me to say thank you so much for joining all of us. And let's keep this conversation going. It's a purposeful journey. Let's make mental health a priority and so that we can work towards a better mental health for ourselves, for our family, and for the country. Thank you so much.